We'll move on now to research in the field of macular degeneration, both dry and wet, and then Mihai and I will field some of the questions. The first area of research is dry macular degeneration, and as Mihai pointed out, we have already had great data from the AREDS 2 study, AREDS 1 and AREDS 2, showing us that this formulation of vitamins and antioxidants, now with lutein and zeaxanthin, can help decrease the risk of getting vision loss from macular degeneration. One thing that's come up recently where people have looked at the AREDS 2 data, they've been reanalyzing some of the data, is to look at the genetic background to patients in that study. So some of you have been in the AREDS 2 study and your blood may have been tested for genetics. It turns out that there are two main genes that are associated with macular degeneration. We do know that. There are many others, but 2 or 3 that are really the key players. But it turns out it doesn't help guide us. It doesn't help guide our treatment. There was certainly a lot of controversy in the past few years where some investigators had looked at this data and thought, well, it's important to know each of your individual genetic subtypes, so we need to know what this formula should be. We could change the formula for you as a personalized formula. But it turns out that's not true. At this time, from the genetic subtypes that we know, there is no benefit in doing a genotype. We know more about your prognosis by looking in your eye. So we can tell by the drusen, the size of the drusen, what's going in one eye or both eyes, and then we can give you at least some statistics on prognosis. So genetic testing at this point is not necessary. The other area of research in dry macular degeneration has to do with that severe form, that atrophy, where there's thinning and people lose central vision. We recently performed a clinical trial to see if we could help prevent atrophy. This is one condition for which there is no treatment. There is no treatment for the severe dry macular degeneration. This clinical trial was designed by investigators in Seattle, but a lot of the testing actually went on here in Madison. Of course, when we start testing on people, that's preceded by some testing on animals, and that was done here at the Covance lab with some veterinarians and ophthalmologists here in Madison. So the goal of this medication was to slow down the metabolism of the retina so that we could kind of slow down the formation of these drusen, those yellow spots. And that was the goal there, is to preserve the functioning of the retinal cells, so slow down the process of macular degeneration. And what was really nice about this study design was that it was a pill. So sort of like the AREDS study, which was also a pill, this was an oral pill. And as in most studies, half of the patients were on the pill, half of the patients were not. And neither the patient nor the doctor would know what the patient was taking until the very end. Just recently, we found after over 2 years of study that this medication did not work. It did not harm the patient, but it did not help to stop this atrophy or thinning of the retina. We are trying, and we are in the middle of, a new study for an injection for the dry form, this atrophy or retinal thinning. This is another new medication. It is not the same as what Justin talked about. It is not Eylea, Avastin, or Lucentis. It doesn't have a name yet. It has a number because it's an investigational drug. It's not something that's available to any of us in the pharmacy or at the doctor's office. In this study, in this experimental investigation, patients are receiving this drug monthly in the same fashion that Justin described. It's the same type of injection where we wash off the eye, we numb the eye, we give that very small dose of medication. Again, as with any study, half of the people will receive the medication, half of the people will receive no injection. So we're comparing excuse me, yes, they will see no injection. So we're comparing this new medication to what is the natural history. The goal, again, is to preserve the retina. At this point, we don't feel these drugs can reverse the thinning, but if they can prevent the growth of that retinal thinning or atrophy. So for this, we have to wait. This will be at least 2 years before we have an answer. But again, an injection, just like you're seeing in wet, patients with the wet kind, may be available in patients with dry. It will be a few years down the road. What about wet macular degeneration? How can we improve on what Justin was describing? We know we need some improvement because, number one, it's a very frequent treatment. So all of those of you who are getting it know that it's a burden to come in so often and get these injections. And we'd like to do better. We'd like to give patients longer time between their treatment, and we'd like to get even better vision. We're not able to eliminate those blood vessels. We are able to stop the growth and stop the leakage in most patients. And again, this treatment isn't perfect because there are patients who won't respond to the injection. A new study that we're doing at the clinical trials unit at the University of Wisconsin is to use eye drops. The eye drops are in addition to the injection. So at this point, we're seeing if the eye drops, also an anti-VEGF, that same type of drug, if that can help give us a longer period of time between injections. So we want to extend that interval. We want to give people more time with the eye drops. Again, it's an experimental phase. Patients have to have new wet macular degeneration. So for many of you, this would not be an option right now. Again, this is an experimental drug. It's only for the patient that came in that's never had an injection. It just happened. The wet macular degeneration just came about. It's possible to consider this investigational research where patients would get a drop and an injection. Again, half the patients will receive the drop with the new medication, half the patients will receive a drop that has no medication in it, the placebo. And I won't know, the patient won't know. That's really what the FDA requires in order to show that a drug is safe and effective. So research in wet macular degeneration is underway. In addition to the drop trial where we're trying these eye drops, we are looking at 2 other trials. One is a trial to look at longer acting medication. Can we get a medication to inject that lasts 4 months instead of 4 weeks? This would be a great improvement. So that's a study that's also underway. And the second study is underway that it combines 2 drugs in 1 injection. So that's a very appealing idea. We know that the standard drug is going to work. This company has developed another drug that may actually get rid of those blood vessels, eliminate those blood vessels. And that idea of combination treatment is very common in cancer treatment. Many of you have known folks with cancer where they've done very, very well with a combination treatment. So the same principle may really help in the eye and the treatment of macular degeneration, and research is coming along. That's been started where we do the combination treatment. Again, these trials, because they're really just underway now, it will take at least 2 years. So hopefully at the next symposium we'll be able